Adrenergic response. Pupils dilate. Heart rate increase. Blood pressure increase. Bronchioles open up, right? Think of all the things you're going to do when you're in fight or flight mode. Bowel and bladder slows down. What about secretions in the mouth and the nose? Dries up. Good. So all the opposite's going to happen for cholinergic response. No, I was talking about adrenergic. All the opposite will happen with cholinergic. All right, so adrenergic drugs, okay, common adverse effects. Should we always throw in orthostatic hypotension? Yes. Absolutely, okay. So if I see orthostatic hypotension, what is your intervention going to be? Check their blood pressure in different positions, and also change positions slowly, you're going to tell your patient, right? So we're going to monitor that. But the common palpitations, tachycardia, they're going to be shaky, they're going to be nervous, all those kind of things, okay, related to adrenergic drugs. The main drugs we're going to use that are adrenergic are which two drugs? They're going to cause a fight or flight response. Think breathing treatments. So what are they? Albuterol and Atrovent, and we know Atrovent is, I can't pronounce it, ipratropium. There you go. Start I-P-R-A-T-R-O-P-I-U-M. Sound it out. There you go. They all are going to cause a fight or flight response, but the goal is to open up their airways, right? So if they say, oh my gosh, nurse, my heart's racing and beating out of my chest and I'm all nervous, you tell them what? Just like a lot of the other drugs, it'll resolve over time. You'll get used to it, okay? Right. Adrenergic. So the fight or flight system is broken down into two categories, two different receptors. What are they? Alpha and beta. Alpha controls what?
Vasoconstriction.
It causes vasoconstriction. Beta causes increased heart rate. Therefore, if I have an alpha blocker or a beta blocker, we know what's going to occur with both of those, the opposite effects. Okay, so an alpha blocker, we said alpha receptors cause vasoconstriction, so therefore an alpha blocker will cause vasodilation. So it's treatment of specifically conditions like BPH, benign prostate hypertrophy, and specifically for the vasoconstriction effects of the disease called Raynaud's disease. These drugs end in what? Alpha blockers. Sin. Okay? I don't know, however you're going to remember that. Sin. Okay, and we had the terazosin was the example that I gave here. We said that. Beta blockers. Know your beta blockers, guys. Beta adrenergic blockers end in olol, right? And so therefore they block the fight or flight response, but since they're beta, they're going to slow the heart rate down, right? They're also going to decrease your blood pressure, which is the common reason your patient's on it, to treat hypertension. Here we have it again. Please don't forget, diabetic patients on beta blockers, what are you going to see? It's going to mask hypoglycemia in those types of patients, okay? We know bradycardia, but now, since we're blocking the fight or flight response, what's going to happen to the bronchioles now if a patient's on a beta blocker? Constriction. So asthmatic patients, emphysema, COPD, should use this very cautiously. Okay? We're going to monitor your patient, heart rate, blood pressure. Heart rate should be no less than 60. Systolic should be no less than 100. Okay. Do beta blockers work ideally right away? No. It takes a while to start working. Should a patient suddenly stop taking their beta blocker? No. What's going to happen if they do? They will die. There you go. It's in your head now. They will die. So they're going to have possibly angina. So think heart attack. Angina followed by an MI, possibly. So we said that. Okay. Cholinergic medications, think acetylcholine. If you remember back in anatomy and physiology, it wasn't that long ago, right? Acetylcholine is also responsible not just for the rest and digest, but it also makes your muscles contract, right? So when you think cholinergic medications, we don't even have any examples, but cholinergic medications would be for things related to muscles, such as myasthenia gravis, which is a paralysis from where to where? From mind to ground. And also if someone's on a muscle relaxant, they overdosed on their Flexeril, you can give them a cholinergic drug to alleviate that. Now, anticholinergics, we said, those are given to, obviously we already said, Parkinson's patients for tremors and drooling, and they work by blocking the action of acetylcholine. So they block that acetylcholine. What's the drug? The one main drug we see with that? Atropine. So no, atropine does what? The main thing we want it to do is to, remember, this is when we see, can't pee, can't spit, can't shit. There you go. All of those, and those are all the side effects we're going to be looking at for this, for atropine. So they're going to treat bradycardia, right? They're also going to treat urinary disorders. Which ones?
Overactive.
So overactive bladder, things with incontinence related issues. We're going to give it preoperatively to dry out their mouth before a surgery. And understand, this is just a thrown-in point there. If your patient, again, is on Parkinson's medications and atropine or an anticholinergic, that you may have psychosis. If they have psychosis, what's the number one nursing intervention to do? Keep them safe. Good. All right. So we said, again, side effects, same things. Constipation, urinary retention, dryness of the mouth, all those kind of things we said. All the cans. If they have, your patient hasn't peed in 8 hours, what do you need to do? Call the physician. If they can't poop, what are some things we can do?
Fiber.
Stool softeners, fiber, fluid intake, right? If the patient says, my mouth's too dry from those anticholinergics, you can say, suck on hard candy, ice chips, chew gum. Good. Ta-da. We got time for the next one? Why not? Lunch? What are you talking about, Greg? It's not lunch.